Welcome to the BrainShape Podcast, hosted by Dr. Andrea Wilkinson, a show where we cut through the noise of the ever-growing, ever-changing world of brain health. What works and what doesn't, what's fact and what's fiction. We look at tips, tools, and techniques backed up by real scientific studies to help you keep your brain healthy and hopefully have some fun along the way. Now, here's your host, Dr. Andrea Wilkinson.
You're listening to the BrainShape Podcast, episode number 10. Sleep is a fundamental basic human need. Just like food and water, we need sleep to survive. Getting enough sleep helps us stay healthy and gives us the energy we need to complete our activities of daily living and engage in the activities that we find enjoyable and fulfilling. It is not surprising, but there's a lot of new research coming out that talks about the importance of sleep for our brain health. So I wanted to bring on a guest to help us better understand sleep in general and provide some tangible tips on improving our own sleeping habits. Today we're talking with Sasha Usyatynsky, a first-year PhD student in clinical psychology at Ryerson University. Her research interests include exploring how individuals with insomnia react to and experience treatment, the connection between depression and insomnia, and how depressive symptoms impact insomnia treatment. Sasha is also involved in the ongoing clinical trials in the sleep and depression lab as a therapist. In today's episode, Sasha will be teaching us valuable information on our sleep system and how it operates. She'll also be debunking myths about sleep, and she'll share with us an overview of the treatment for a sleep disorder like insomnia. This episode is great for anyone interested in learning more about sleep and the importance of trusting your body when it comes to getting the sleep that you need. Here we go. Here's Sasha Usyatynsky. Hi, Sasha. Thank you so much for joining me today.
Hi, I'm very, very glad to be on the podcast.
I'm wondering if you can start by telling the listeners a little bit about yourself and your history and how it is that you got involved with studying sleep.
Yeah, absolutely. So I'm a clinical psychology graduate student. I'm just finishing up my first year of my PhD at Ryerson University, where I also got my master's. I did my undergrad at Queen's studying psychology. And so when I applied to grad school, I applied to the sleep and depression lab, which we call the SAD lab, under Dr. Colin Kearney, who's, I guess, one of Canada's leading researchers in psychological treatments for insomnia. And I actually applied to the lab with an interest in depression specifically. I didn't know that I was interested in sleep or insomnia. And then when I joined the lab, I actually realized that insomnia is such a huge part of depression, but also it's like a transdiagnostic phenomenon. It applies to everything, and that sleep is so important. And so I just got so interested in that I've still am interested in depression, but really feel like an insomnia researcher now.
I didn't actually know about the link between insomnia and sleep difficulties and depression. So this is going to be a very interesting conversation. So I'm wondering if we could maybe start off a little bit in the general sense, and where you could tell us a little bit about sleep systems and how they operate.
So I guess to be brief, there are two systems that work in tandem to regulate normal sleep, and a third system that can interfere with them. So the first system is our circadian rhythm. Our circadian rhythm you can think of as our internal body clock, and it regulates a whole number of things in our body, like when our brain sends alerting signals for us to be wakeful, when we get hungry, when our body temperature fluctuates throughout the day. For example, it gets lower at nighttime when we sleep. And as it applies to sleep, the circadian rhythm really helps us feel alert and wakeful during the day. And the tricky part is that our internal body clock works on close to a 24-hour schedule, but it's not actually quite 24 hours. It's a bit more than that. So it's constantly getting out of sync with our clock on the wall, which is strictly 24 hours. So kind of what we need to do is match it up so that we're able to feel our best selves during the day. And we do that by regularizing our schedules. Eating meals around the same time every day, getting exercise or socializing around the same time every day, and most importantly, getting up and out of bed and getting some light exposure early in the morning, but consistently at the same time every morning. And unfortunately, our bodies don't actually know the difference between a weekday and a weekend. So when we sleep in on the weekends, so it feels so nice, or just generally have a variable sleep schedule, it can actually create some problems for us with our circadian rhythm and give us this jet lag syndrome, where we're kind of creating jet lag for ourselves instead of being in a different time zone where you're mismatched from the clock on the wall. You're doing it right here in the same place without actually going anywhere by having a different wake-up time day to day. So yeah, regularity is kind of the key for that system. Now, the second sleep system that operates is the lesser-known sleep drive. And our sleep drive is the need for sleep at any given point throughout the day. So when we first wake up, it'll be pretty low since we just spent it on sleep for that night. And as soon as you get out of bed, your feet hit the floor, your sleep drive starts to build. The more active we are throughout a 24-hour day, and the more things that we do during the day, the faster and higher it will build. So it doesn't mean we have to go to the gym every day, but basically the more you are walking around, socializing, being somewhat active rather than sitting down at a desk all day or on a couch all day, your sleep drive builds up higher. And so when it gets close to our bedtime, we'll have ideally built up enough drive to get ourselves a good quality sleep. It's kind of like having a big sleep appetite. And it doesn't mean that we'll sleep for a long time necessarily. It's more to do with the quality of sleep that we get. The higher our sleep drive, it'll probably be easier to fall asleep quickly, but mostly it'll give us more deep sleep. And that is quality restful sleep when our body produces the hormones we need to feel refreshed the next day. And so things like having a nap or having a rest during the day is like having a snack. It's like eating before the full course meal. And so your appetite for sleep won't be as high when it actually gets time for that sleep meal at night. And you won't be as hungry for sleep at 10 p.m. like you would normally, for example. So you need to stay up later to keep building that appetite. And so basically if those two systems work together, your circadian rhythm is strong and set, and you're building up your sleep drive during the day by being active, then you're going to have a good 24-hour period of healthy wakefulness and sleep. But the final system that interferes with all of this is actually anxiety. So evolution cares about our survival, and so if we're really sleepy but then suddenly a bear appears nearby, we want our body to kick us into fight or flight and override our sleepiness, no matter how sleepy we are, to deal with the threat. The issue now becomes we're probably not fighting any bears, so instead we tend to feel anxiety about other things. The bear becomes worries about our day, fights with friends or family, or actually worries about sleep itself. And so all of those things are incompatible with sleep, right? And so if you're anxious when you're getting into bed, it's kind of like that saying, don't go to bed angry. You probably won't actually be able to go to bed angry because you won't fall asleep. So what you want to do is you want to get out of bed if you're worried and you can't sleep. So those are kind of the general sleep systems that regulate our sleep.
Very interesting. So what insights can you provide for the listeners? So most of the listeners for the BrainShape podcast are adults over the age of 60. Mm-hmm. And so I'm wondering if we can maybe talk a little bit about normal age-related changes that can be expected in our sleep patterns.
So I'll speak a little bit about the normal age-related changes in sleep, but also a little bit about like our behavioral changes as we age as well, because that's kind of really important. So many people talk about how quality of your sleep actually goes down as you age. There's a lot of correlational research about this, that aging is associated with a poor quality sleep. And it's actually not an inevitability because it has to do with some contextual issues. So if we think about what happens as we age, your need for sleep, which is largely biologically determined, it doesn't really change. So if you were a 7-hour sleeper while you were an adult and you were working, and after 7 hours of sleep you were feeling fine and well rested, you don't suddenly become a 5-hour sleeper or a 9-hour sleeper when you turn 65, for example. Your body's natural need for sleep isn't going to go up as you age in the absence of other sleep disorders, which I can get into as well. So assuming that no sleep disorders like sleep apnea are present, if you were sleeping 7 hours and feeling good before you got older, you're still going to be a 7-hour sleeper. But what does happen as people age, many stop being as active as they were before. They become less physically active, less socially active, and just start moving around less, which a lot of the time can be linked to pain, developing pain as you age. And now, knowing what we know about sleep drive, basically, if your level of activity goes down during the day, it logically follows that your time spent in bed should also go down. Your sleep drive won't be as high, so you'll want to stay up later to get more sleep drive, to build up that appetite. But what actually happens instead is that people end up spending even more time in bed than they used to as they get older. People, they'll take naps, they doze, they linger in bed in the morning. They get to bed earlier than normal because kind of that's either what people think that they should do as they get older, especially if people are worried about getting sleep. You know, it makes sense to start spending more time in bed and trying to be more restful. Or just because sometimes people have like this newfound free time and they don't know what to do with it, and they end up napping or just spending more time in bed because there's just nothing else they can think of to do. And what this does, though, is it means that they're trying to spend the 7 hours of sleep that their body can produce over a 9-hour sleep window, for example. So if you think of it this way, it's like you're using a small chunk of butter to butter one slice of toast, and suddenly you get another small slice of toast, but you don't get any more butter. And so now both slices of toast will be poorly buttered, have a very thin layer and probably no butter in some spots because you're trying to spread the same amount of butter over 2 slices of toast when it's really only meant for 1 slice. And the same thing happens with sleep. You're stretching your good quality sleep into a poor quality sleep by trying to fit it into a longer sleep window. And because of that, you're probably going to experience a worse quality sleep and probably more wakefulness in the middle of the night when you're trying to fall asleep. So what we see when people age isn't just that their sleep quality gets worse. Their sleep quality gets worse because they're not accounting for changes in their lifestyle. So there's definitely healthy aging if you account for some of those things. And another thing that actually ends up happening that is like biologically related to sleep is that your eyes start changing and light information won't get in as much. So that's related to your circadian rhythm. And basically setting your circadian rhythm has to do with getting light exposure in the day. So you actually might want to start spending more time outside and getting more light exposure as you age. And so Dr. Carney, my supervisor, kind of suggests that it's kind of really simple what you should do as you age. Think of what young children do. Young children spend a lot of time outside, thereby getting more sun exposure. They're also very physically active and moving around and doing enjoyable things, which increases your sleep drive if you're being active. And young children also have a very regular schedule. Just like a little kid on a schedule, we want to be more consistent. So set a consistent rise time, have meals at regular times. And just like for kids who get scheduled play dates, you want to socialize and exercise more, but particularly at regular times. And the last piece that kind of what we talked about, you don't want to spend more time in bed than you need to. If you could only sleep for 7 hours, then you should get up and get out of bed. And don't go to bed unless you're actually truly sleepy.
Can you speak a little bit about some of the myths about sleep that exist and how we can minimize any negative impacts these myths might have on our beliefs about sleep?
Of course. So one big myth is that there's some golden number that we need, say, 8 hours of sleep to feel good the next day. And that's a myth that's largely perpetuated in the media. But it's actually not true because everyone has a different need for sleep, and thinking that you need to sleep, say, 7 or 8 hours a night sets unrealistic expectations for yourself if you're not an 8 or 7 hour sleeper. And when you don't meet these expectations, because you can't, because you don't sleep that much, you'll get anxious about your sleep and that's sleep interfering. So some people need 3 hours of sleep and feel totally fine. Some people need 10 hours of sleep and feel totally fine. Most people do fall in the 6 to 8 hour range, but any individual might be outside of that. And so the key is really just to listen to your body and just don't think of what anyone else is doing. Another myth is that you're supposed to sleep without waking throughout the night. That's actually not true. Our brain wakes up on average 12 times an hour in the middle of the night. However, it's not true awakening. We do generally wake up a couple of times, like notably in the middle of the night, and that looks more like us turning over and just rolling over to the other side and instantly falling back asleep, or getting out of bed, going to the bathroom, and getting back to sleep. If those awakenings aren't longer than, say, 5 minutes, then that is actually completely normal. It usually happens more so in the second half of the night when you're going through stages of REM sleep rather than the first half of the night when you have deep sleep. So that wakefulness is normal. The issue is if that wakefulness is a long period of time and you can't get back to sleep, that's when problems happen, but it's kind of unrealistic to want to fall asleep and stay asleep without waking at all until you get up in the morning. And finally, the last myth I guess I want to mention is that we can control our sleep. That's very much not true. Our body takes care of that. You don't try to force your heart to beat or force your lungs to breathe. So we should all really stop trying to force our body to fall asleep, because it creates a paradoxical effect. The harder you try, the further away it gets. Another favorite analogy of Dr. Carney is that falling asleep is like falling in love. It's a mess when you try to force it. So she's very fond of that one. And so the solution is to have confidence in your body and know kind of that your body knows what it needs, and just listen to it. If you're not sleepy, don't go to bed. If your body wakes up and is fully awake, then you should get out of bed and start your day.
Interesting. But I guess there is also some flexibility in our sleeping pattern. So, for example, I have a habit, I think, of going to bed a little bit too late, and I'm trying to push it earlier because I want to get up earlier, but I still need my 7 hours. And so I'm trying to sort of, I guess, retrain my body to just get into bed and get to sleep a little bit earlier. And I think that'll take a little bit of time. So there is some flexibility in that, I'm assuming, because at this moment, you know, my body only gets tired at midnight, but I want my body to get tired at 10 p.m. So I have to sort of try to train it.
Yeah, you can definitely retrain your body and actually shift your sleep window. You're right. The anchor point for that is actually your rise time. So getting into bed earlier doesn't guarantee that you will fall asleep earlier. The key to shifting to an earlier bedtime is shift to an earlier rise time. And so if you said you want 7 hours of sleep and you can produce 7 hours of sleep, so say your your wake up time is 7 a.m., for example, then consistently getting out of bed at 7 a.m. will mean that you're getting sleepy consistently around the same time at night. And if your body needs 7 hours of sleep, it'll be around midnight consistently. And so, yeah, you can shift that sleep window, but the anchor should be the rise time rather than the bedtime, because your sleep needs are going to change day to day as well, right? Sometimes we're more active. If you are running a marathon, you're going to be sleepy earlier than if you sat around on the couch all day and did nothing. Right. So your sleep bedtime is going to vary night to night. The rise time is the thing that you really have the control over. Very
interesting. So I will pay attention to my rise time if I want to sort of moderate and change up when I'm actually getting tired. So that's very important insight. So although it has long been assumed, there's a lot of research that seems to be coming out now that's talking about the importance of sleep on our brain health. And I think it's really interesting to the audience that listens to this podcast, specifically adults that are over the age of 60, when we talk about the link between sleep disruptions and the changes in the structure of the brain. So there was this review study that came out by Song et al. In 2019 that talks about the direction of this relationship. So they actually, from this review, revealed that this relationship is sort of bi-directional. So age-related brain changes lead to sleep difficulties, but also that these sleep disruptions can accelerate the rate at which the age-related brain changes occur.
Right.
So I'm just wondering if you, from your research or anything that you've read, if you've learned anything about the impact of sleep quality on different parts of the brain.
I think it's a very good question. It's an important question because we do get people that are concerned about this a lot. People with insomnia who are worried about their health because they read all of this kind of research or articles about it. And there have been a lot of correlational studies that getting chronic poor sleep quality is associated with a whole number of issues like depression, high blood pressure, dementia, things like that. And I do want to clarify that because these are correlational studies, basically what we have learned is that it's actually not really insomnia that is at the forefront of these problems. And what I mean by that is that it's actually obstructive sleep apnea that is one of the notable things that is related to kind of what you're talking about, the age-related brain changes impacting sleep problems and vice versa. Mm-hmm. So obstructive sleep apnea is a sleep disorder that is more common in the elderly. So as people age, their likelihood for developing it does go up. And so a recent study in the European Respiratory Journal in 2018 by Cross and colleagues, they actually discussed this issue. And so obstructive sleep apnea leads to breathing interruptions in your sleep. And when you have so many breathing interruptions in your sleep at night, it reduces the levels of oxygen in the blood. And so according to Cross and colleagues, this drop in oxygen may actually be linked to a shrinking of the brain's temporal lobes, and so a corresponding decline in memory. So the obstructive sleep apnea is what impacts kind of that brain structure. And because of this, it impacts dementia. So what they suggest really strongly is that screening older adults for sleep apnea and giving them treatment when it is needed could actually help prevent dementia in older adults. They mention that about 30 to 50% of the risk of dementia is due to modifiable factors such as depression, high blood pressure, obesity, and smoking. And now sleep apnea is coming out as another factor. And so, basically there's 4 indicators that someone might have sleep apnea. And so loud snoring is one of them, feeling sleepy during the day, high blood pressure, and then someone actually observing you stopping breathing in your sleep or choking or gasping in your sleep. If someone has even one of those, but usually you would see 2 or more, then it's definitely recommended you should talk to your sleep, not your sleep doctor, just any doctor about your sleep. And so sleep apnea is actually kind of the silent killer, because all of those studies come out saying, it's an impact of poor sleep quality. And so people think of insomnia as being a major issue when it's actually, there's a confounding variable of the sleep apnea. And that is really what's driving a lot of the age-related changes in your brain structure. And one thing to note about sleep apnea is that it is actually notoriously underdiagnosed in slim women, because it's also associated with a higher body mass index and being older in male. And so if someone has sleep apnea-related symptoms, it doesn't matter what your body mass index is, or if you're a woman or not, you should really advocate for yourself with your doctor, especially if you're a slim woman, but you are experiencing some of these symptoms.
And do you know anything about the diagnosis, the process at which someone is diagnosed with sleep apnea? Meaning, obviously the advice is to go to your physician and to talk about, potentially being evaluated for sleep apnea. But then do you know what the doctor actually will do? Yeah,
the process is getting a sleep study. So actually a lot of people have, as they age, have already done a sleep study, and something might have come out with that. And the treatment for sleep apnea is a CPAP machine. But so what they do is you talk to your doctor. They would do, ask a couple of questions. They have a couple of indicators that someone might have sleep apnea. And then if it's a serious concern, they would refer you to do a sleep study. That is when you go into a sleep center and do an overnight sleep study. So they hook you up to all the machines and monitor your sleep throughout the night. And that is how sleep apnea is diagnosed. And then they would walk you through the treatment for that.
So I know a lot of your research specifically looks at the treatment of insomnia. And so I'm just wondering if you can first give a little bit of a definition of insomnia for any listeners that are curious, and then talk a little bit about how insomnia is developed and maintained.
Of course. Yes. So that is predominantly what my research is about, and the research in our lab in general. Insomnia disorder is a chronic sleep problem. It is defined by difficulty falling asleep, difficulty staying asleep throughout the night, or difficulty waking up too early, or any combination of those 3 problems, happening at least 3 nights a week for 3 months or longer. Anything happening a sleep problem less than 3 months would be potentially an insomnia problem, but it is not diagnosable as insomnia disorder. However, it can develop into a chronic insomnia. But the defining feature of insomnia is actually that it causes significant distress or impairment in functioning for the person. So someone might be having sleep difficulty, but if they're not actually concerned about it, it wouldn't be a clinical issue. And so usually the reason insomnia develops isn't actually what maintains it in the long run. So this this is the 3P model by Spielman. It's kind of one of the biggest insomnia theories in the field right now. So the first P stands for predisposing factors. Some people are just inherently more likely to develop insomnia. For example, people who are more anxious or have a more active sleep system. The second P stands for precipitating factors. So usually some life event triggers a transitory or a brief bout of insomnia. This might be stress at work, going through a divorce, having an illness of yourself or a loved one, having a new baby, construction outside your window, kind of anything that gives you a brief sleep problem. But then when the event passes, insomnia usually goes away for most people. And so the last P stands for perpetuating factors that make this brief insomnia into a chronic problem. And these are typically behaviors that people do, like taking naps, or sleep beliefs or thoughts about your sleep, like excessive daytime worry about your sleep, that people adopt in order to cope with sleeplessness. And so these things all make sense, and we do them trying to make things better. But because most people don't have the knowledge of the sleep system, it ends up potentially being helpful in the short term, but in the long run, it kind of does the opposite, and it perpetuates insomnia, because what it's really doing is interfering with those two sleep systems that regulate sleep, the circadian rhythm and the sleep drive, and they amp up anxiety. So that is kind of what maintains insomnia in the long run. So treatment for insomnia is focused on changing those behaviors and beliefs.
And can you speak a little bit about the relationship that exists between insomnia and depression?
Yeah. So insomnia and depression are definitely linked. Insomnia is oftentimes a symptom of depression. Sometimes treating depression means that the symptom of insomnia can go away. And oftentimes there are both problems in their own right. So there used to be a distinction between primary and secondary insomnia that is no longer part of the diagnosis. Now it's just insomnia, and basically treating depression only without treating an insomnia problem that actually warrants its own treatment, that is clinically significant, can be problematic because research shows that if kind of that happens, you're treating just the depression, but the insomnia still stays. Sometimes insomnia doesn't go away even if the depression goes away, and it puts you at higher risk of relapse for depression. And so likewise, insomnia can be difficult to treat in very severely depressed individuals. And so because of this, you kind of want to take a two-pronged approach. You want to treat the depression and you want to treat the insomnia if the insomnia is severe enough.
So I wonder if we could talk a little bit about the actual sort of treatments for insomnia. If you want to frame it in terms of cognitive behavioral therapy or CBT, and sort of what work have you done around the treatment of insomnia and what that sort of looks like for people?
So CBT, so cognitive behavioral therapy, in general, is based on a theory that our thoughts, our behaviors, and our emotions are linked and act on each other. And so in the case of insomnia, it's not just emotions, it's also sleep that is being impacted by your behaviors and your thoughts that impacts both of them in turn as well. And so CBT for insomnia is really focused on helping the person get out of their body's way, because your body knows what to do, and kind of all those little things that we're doing that get in its way, we want to cut that out. CBT is the gold standard treatment for insomnia, so it is definitely the most recommended treatment for insomnia, but it can be definitely difficult to access it. And it has been shown to be quite effective in treating insomnia. So the treatment we do in our lab, it's a 4-session brief CBT for insomnia, and we have, I think right now, an 82% remission rate.
Oh, wow.
Yeah, so people that come in with insomnia, and by the end of the 4 sessions, they are okay. And
wow.
Of those, there is, over the next year, there's very, very little relapse. So at least for 1 year, kind of, the effects are maintained. Interestingly, research actually also finds that CBT for insomnia is actually a pretty effective treatment for depression as well. So even if treating depression isn't the goal, if you're just treating the insomnia. So we're currently doing research to find out why that happens, and why treating insomnia can be so good for depression. But basically, I can give you like a little outline of what CBT for insomnia would look like.
Yeah, exactly. I was just about to ask you.
Yeah. So based on the 3 sleep systems we talked about earlier, you want to build up a high sleep drive. So to build up your high sleep drive, you want to get out of bed as soon as you wake up or within 5 to 15 minutes. You want to be active during the day, both socially and physically. And you want to avoid being inactive. So if you got a really bad night's sleep, don't conserve your energy. Just kind of keep living your life as you normally would. Don't spend all day on the couch. Don't take naps. And then don't lie on the couch before bed watching TV because that's effectively resting as well. The next thing you want to do is have a good, strong circadian rhythm. So regularize your activity, including even if you got a bad night's sleep, you don't want to sleep in. And then get light exposure in the morning by getting outside for even a brief walk. And then you also want to make sure that you don't associate the bed with wakefulness. So the more time we spend awake in bed, the more likely is that we'll become like Pavlov's dogs. So if you're familiar with the experiment, basically Pavlov would give dogs food, and he saw that they would salivate because that's the body's natural response to seeing food. And then he started ringing a bell every time he gave them food, so the dogs learned to associate that the bell equals food. And to the point where Pavlov would ring the bell without giving them food, and they would start to salivate. It turns out that we're not much more complicated than dogs. And if we spend time awake in bed, we become conditioned. People might be sleepy, they're ready for bed, they get into bed, turn off the lights, and as soon as they hit those lights, it's like a switch went off in their head, and suddenly their brain is active with random thoughts. And that's conditioning. So if someone has trouble falling asleep or just trouble sleeping in general, they'll want to take all wakeful activity out of the bed. This includes reading in bed, watching TV in bed, and you want to get up and turn on the lights and get out of bed when you can't sleep. So people who lie there tossing and turning for half an hour, sleep isn't coming anyway. So you might as well be out of bed and doing something pleasant rather than tossing and turning, getting more and more frustrated, which we know makes sleep harder and harder to get.
Right.
And so you want to only get back into bed when you're truly sleepy again. And likewise, only get into bed when you're really sleepy, even if it's kind of your bedtime. If you're not ready for sleep yet, then kind of why are you getting into bed and setting yourself up for failure? And then as for the thoughts, you can give yourself a wind down period before bed to let your mind kind of process the day, so it doesn't need to do that when you get into bed. Usually half an hour before bed, you want to do something mindless, let your attention wander, and so your mind can process, like doing the dishes or doing a coloring book, something like that. But the most important thing to remember is that your body knows what to do, and it will give you the sleep that you need. You don't need to control your sleep because actually you can't. And so if you're thinking like a good sleeper, meaning not worried or even thinking about your sleep, then you will become a good sleeper. One little caveat is that all of these recommendations are ones that we give people that are having sleep difficulty to get their sleep back on track. And so if someone isn't worried about their sleep, then they don't need to do those things, really. People can read in bed, sleep in on the weekends, whatever. As long as they're feeling like a good sleeper, then it's okay. Likewise, if you're having trouble sleeping and then you do all these recommendations and your sleep gets better, your confidence about your sleep goes up, you can start experimenting with some of these things again.
Right. So my dad is 78 years old, and he has a lot of difficulties sleeping at night. And so he, as a result of not sleeping at night, is very tired during the day and takes quite a substantial nap, in my opinion, during the day. And so my assumption is that this long nap, I'm going to estimate it's like 2 hours from 3 to 5 p.m. is reducing his sleep drive, and so is creating difficulties for him to actually sleep during the nighttime. And so my recommendation to him was to think about sort of reducing that nap or to cut that out so that his sleep drive can actually ramp up. His argument is that he's actually so tired during the day because he's really not sleeping at night that he cannot stay awake. So he has to take that nap. And so I'm wondering if, because we were talking about, your body knows what to do and you should just trust it, if it's possible that his sleep patterns are just in this way and that there's sort of no point in trying to force him into a quote unquote normal sleeping pattern, if we should just leave it the way that it is?
Yeah, so I guess for people like your dad, I would say it's really a matter of values. If he's not worried about how he sleeps at night and would rather sleep less at night and then have a nice nap in the daytime, then that's okay. However, this shift in your behavior should come with a shift in expectations for what your sleep can reasonably look like at night. And so if you're going to be sleeping 2 hours during the day, you want to shorten your expectation for sleep at night by at least 2 hours. So you'll want to spend at least 2 hours less in bed at night because of the daytime nap. But then if you're not concerned about it, then that's great. You kind of said that he has a concern about his sleep. He's having sleep difficulty. And so if he is worried about that, then potentially cutting out the naps might be a good thing. But it might also be that, he's concerned about his sleep because he thinks that he should still be sleeping the same at night and still take the nap, which isn't realistic. If you're taking a nap, you need less sleep just by virtue of needing less sleep at night. And then if you kind of adopt that new way of thinking about it and you're fine with that, then I don't think that there's too much of a concern. But another thing to consider is kind of what is he doing during the day? Most people, you mentioned 3 to 5 p.m., and I thought that was interesting because most people feel this post-lunch dip in energy that's associated with a drop in your body temperature that just naturally happens around that time. And people actually get more fatigued during that time. They get more tired. But they're not usually like sleepy. It just means that their energy levels are down, so they potentially think that they might want a nap. And so during that time, if you're being inactive, if you're sitting on the couch or watching TV or otherwise being inactive, then it makes sense to want to take a nap. And so one thing to experiment with is when your dad gets sleepy during the day, instead of going to take that nap, try to substitute it with something activating. Go for a walk, at his own pace, or at the very least, stand up, stretch, have a sip of water, have like a lap around the room. And most people notice that their energy level actually goes up. Many people, take naps as they age because that's just something that they feel like they should do because there's not much else to do in terms of activity. And so it might be something to do to brainstorm kind of meaningful activities that you can start incorporating into your life, which will even help with mood. And so the final piece that I want to say is that there is really a distinction between sleepiness and fatigue. And so if someone's actually feeling more sleepy during the day, like actually likely to fall asleep rather than just feeling tired or fatigued, and they're having trouble sleeping at night, this could be related to sleep apnea. And so if they haven't been checked for sleep apnea yet, and they're not, and they are often truly sleepy during the day and having difficulties at night, it might make sense to talk to the doctor. That is something we see with sleep apnea when people are like, I need to sleep, I can't stay awake. It could be related to that potentially.
Right. That's really interesting. So I will absolutely let him know. And so I know we've talked a little bit about sleep apnea, but what are some of the other sleep diagnoses that you can tell us a little bit about?
So I guess the other big ones would be restless leg syndrome or periodic leg movement disorder, and then circadian rhythm disorders. So with restless legs and periodic limb movement disorder, it's when people find their legs are moving or twitching repeatedly when they sleep. And then if you notice it yourself or if someone's mentioned it, or if you find kind of your sheets are bunched up at the bottom of the bed and they're all, coming off like at the sides in the morning, then you might want to talk to your doctor about those conditions because they make up for a less restful sleep and then make you sleepy during the day. So similar symptoms to sleep apnea. They interfere with a restful sleep. Now, circadian rhythm disorders, the main circadian rhythm disorders are delayed or advanced sleep phase. And that's when your sleep window is shifted by multiple hours from what is normal. So basically people who are extreme night owls or extreme early birds, and they want to go to bed really late and sleep in really late, but otherwise their sleep is normal within those shifted hours. And then there's advanced is someone who wants to go to sleep really early and wake up really early. And the main problem with them is that your body just wants to function on a schedule that's not normal within our society. But there are treatments for this if you talk to your doctor.
Yeah, absolutely. So thank you so much, Sasha. This was super insightful. There was so much information that you shared about sleep patterns in general and our sleep systems and insomnia and all of the different components that can impact our ability to get good quality sleep. So I'm so thankful for you for spending the time with us today and providing so much insight. So if any listeners wanted to get in contact with you, where's the best place they could go to find you?
So probably the sleep lab that we have at Ryerson, so the Sleep and Depression Laboratory, and they can either email our lab coordinator, Olya, and her email is olya@ryerson.ca, or they can give our lab a call, and if they leave a voicemail, we'll get back to them pretty quickly. The phone number is 416-979-5000, and then the extension is 2185.
Great. And you guys have some new research projects coming out?
Yes. So we have, right now we're wrapping up one clinical trial, but we're going to be starting an open trial where we are going to be providing CBT for insomnia. And we're starting it up kind of any day now. And even if someone isn't eligible to be in one of our research studies, because we do have specific criteria for what we're looking for, we still have a ton of resources and referrals that we can make for someone that they can see, or books or readings they can do. So feel free to reach out regardless. And thank you for having me. I love talking about this, obviously, and I think it's something that isn't talked about enough, because not a lot of people kind of know about these things. And so any chance I get to talk about it, I think is great.
Absolutely. We really appreciate it. Thanks so much, Sasha. Have a great day.
Thank you.
To learn more about the work that Sasha is doing in the Sleep and Depression Lab at Ryerson University, you can visit their website. I'll put the link in the show notes page. You can also call their lab directly at 416-979-5000, extension 2185, or email their lab coordinator, Olya, at olya@ryerson.ca. If you've missed any of this, you can dive into the show notes for this episode and all past episodes at www.brainshape.ca/podcast. To access the show notes from today's episode specifically, just type Sasha in the search bar and today's episode will pop right up. Thank you so much for tuning in. I hope that this episode gave you some valuable insights into your sleep systems and the importance of being consistently active throughout the day to help increase your sleep drive, as well as getting light exposure first thing in the morning to build a strong circadian rhythm. Don't forget to subscribe to the podcast so that you'll be notified every time we publish a new episode. And since we're a weekly show, I'll see you back here next week. In the meantime, you can follow me on social media at BrainShapeTO, and be sure to let me know if there are any specific topics that you want me to cover on the podcast. Until next time, keep your brain in shape. And as always, it's been such a pleasure to hang out with you.